Nancy joins us with dermatologist Dr. Sonia Batra, and you're in such good hands here, and you have to understand one thing, which is you have no reason to be embarrassed. This is a problem outside of your control. That's why you're here today, but you shouldn't be embarrassed, Nancy. There is a way to improve this, and I know that's what you want and that's what you need. So, Dr. Batra, what did you find?
So I found when I met Nancy that, this really all came on about 4 to 5 years ago, and this condition or excess sweating has a name. It's called hyperhidrosis, and most commonly does affect the palms, the soles, under the arms. But in about 10% of people who have this condition, it can affect really predominantly the face and the scalp, and that's called craniofacial hyperhidrosis. And, there are, I think, a couple contributing factors. 4 to 5 years ago, you shared with me that you went through a number of really hard stressors, and then that anxiety component played, I think, a very large role. We talked about some of the medications you take and other medical conditions that may contribute to this as well. But interestingly, there's been a slew of recent data that just came out in the last couple of years that there's a subset of people with this particular condition, with hyperhidrosis, where it occurs in postmenopausal women, and it preferentially affects the face and the scalp. And those patients actually tend to be more resistant to the other treatments. So the good news is, in that subset of patients, as with other patients with hyperhidrosis, we have some really good treatment options. And one of the things I was going to recommend for you certainly was, instead of giving you pills that add to the other systemic medicines you're taking, we can compound a pill in a cream called glycopyrrolate, and that would be something you would use before you officiate a wedding or before an event that would keep the sweat from coming. But in terms of a longer-term fix, there's also Botox, or botulinum toxin, which, it's interesting, the same chemical that tells your muscles to contract tells your sweat glands to release sweat. It's called acetylcholine. And so that's why we can use it for wrinkles, but it's also FDA approved very effectively to treat hyperhidrosis under the arms. In this case, we'll be using it on your scalp and your face just to try to really shut down for the next 6 months that sweat production.
So I know you have a treatment here.
Let's start.
Are you game for this?
Yes.
And while Dr. Batra prepares to get started here, I think sometimes these things and problems can be a side effect of another medicine you're taking. So that's why it's so important to talk with your doc and go through a really thorough history and physical, as I know you did with Nancy. So, you ready?
I'm so ready.
And it's interesting you're talking. We know that sweat glands are controlled by the autonomic nervous system, right? And just the fact that she went through this period of high stress and issues going on, that somehow that may have affected her autonomic nervous system.
Absolutely.
You okay, hon?
You're doing all right, Nancy.
Now, out of curiosity, does this take about the same time in terms of how long you'll notice a decrease in the sweating as it works with wrinkles?
It is. I mean, this should kick in within a week, and she should notice markedly less sweating. She should also have at least about a 6-month sustained response from this. Now, I am also going to give her that cream I mentioned, which is the glycopyrrolate, and I also brought for her, because she shared with me, sometimes when she sweats like this, she's really just rubbing and breaking down her skin. So I also brought for her a barrier cream that's a prescription-strength cream that we often give to people with inflammatory conditions like eczema, that's just going to help keep her skin really intact, so that from the moisture and from the rubbing, it's not always getting inflamed. Now, Nancy, I also do want to see this through. So I'm going to talk to your doctors back home in Colorado, because I think there may be, my gut tells me there may be some contribution of the other medicines you're taking as well. So I'd like to work with them to see if we can maybe substitute or coordinate a little bit differently, because I think that in the longer term, that will also help really keep this at bay and keep it better controlled.